Welcome to our comprehensive training on bloodborne pathogens. Today we'll cover what bloodborne pathogens are, how they are transmitted, the importance of personal protective equipment, handling and disposing of contaminated materials, exposure response, and regulatory standards.
Section 1. Introduction to bloodborne pathogens. Bloodborne pathogens are infectious microorganisms in human blood that can cause disease in humans. These pathogens include, but are not limited to, hepatitis B, HBV, hepatitis C, HCV, and human immunodeficiency virus, HIV. Understanding what BBPs are and how they can be transmitted is the first step in protecting yourself and others. BBPs can be transmitted through contact with infected human blood and other potentially infectious materials, such as semen, vaginal secretions, cerebrospinal fluid, and any body fluid visibly contaminated with blood. Industries with higher risks of exposure include healthcare, emergency response, law enforcement, and sanitation. However, all workplaces should have preventative measures in place.
Section 2. Preventing bloodborne pathogen exposure. Prevention is key. Personal protective equipment, PPE, plays a crucial role in protecting workers from exposure. Always wear appropriate PPE when there is potential exposure to bloodborne pathogens. Gloves should be worn when touching blood, body fluids, or contaminated surfaces. Gowns protect clothing and skin, while face shields and masks protect mucous membranes in the mouth, nose, and eyes. It's equally important to know how to properly put on and take off PPE to avoid accidental exposure. Ensure gloves cover the cuffs of gowns and don't touch your face with contaminated gloves or hands. Dispose of used PPE in designated containers and follow your workplace-specific guidelines. In addition to PPE, workplace labeling and signage are critical. Biohazard warning labels must be affixed to containers of regulated waste, refrigerators, or freezers containing blood or other potentially infectious materials. These labels alert employees to the presence of hazardous materials. Section 3. Handling and disposing of contaminated materials. Handling potentially contaminated materials with care is essential. Use mechanical means such as tongs, forceps, or a brush and dustpan to pick up potentially contaminated sharp objects rather than using your hands. Dispose of sharps immediately in designated sharps containers that are puncture-resistant, properly labeled, and placed conveniently close to the work area. For other contaminated materials, such as used gauze or PPE, use clearly marked biohazard bags. Ensure these bags are sealed securely and transported using proper containment methods to prevent spills. If you're responsible for cleaning contaminated surfaces, use an appropriate disinfectant. Follow the manufacturer's instructions for dilution, application, and required contact time for effective decontamination. Clean up spills immediately, starting from the outside and working inward. Section 4. Exposure response and incident reporting. Narrator. Despite best efforts, exposure incidents can occur. Knowing how to respond promptly and effectively can mitigate risks. If you sustain a needle stick injury or any other potential exposure, immediately wash the affected area thoroughly with soap and water. For mucous membrane exposure, flush the area with water or saline for at least 15 minutes. Report the incident to your supervisor right away, no matter how minor it may seem. Complete an incident report to document the exposure, including details of how it occurred and the actions taken. This documentation is crucial for follow-up and medical evaluation. Post-exposure evaluation and follow-up include medical evaluation, testing of the source individual if their status is unknown, and possibly receiving post-exposure prophylaxis. Early intervention can significantly reduce the risk of infection. Section 5. Regulatory standards and training. Understanding and adhering to regulations is essential for maintaining a safe workplace. The Occupational Safety and Health Administration, OSHA, has established the Bloodborne Pathogens Standard to protect employees. This standard requires employers to implement an exposure control plan, provide annual training, and ensure proper record keeping. An exposure control plan outlines how your workplace mitigates exposure risks and includes procedures for evaluating exposure incidents. OSHA also mandates that training be conducted annually and when new tasks or procedures affect occupational exposure. Training topics must include access to the Bloodborne Pathogens Standard, Exposure Control Plan, control measures, PPE, hepatitis B vaccine, and post-exposure procedures. Regular, thorough training ensures employees are aware of their risks, the protective measures in place, and the proper responses to exposure incidents. In conclusion, protecting yourself from bloodborne pathogens requires a combination of knowledge, vigilance, and adherence to established safety protocols. By wearing the appropriate PPE, handling and disposing of contaminated materials correctly, knowing how to respond to exposures, and staying informed through regular training, we can create a safer and healthier workplace. Thank you for your attention and commitment to safety. If you have any questions or need further information, please contact our safety director or refer to the provided safety resources. Stay safe, stay informed, and maintain a culture of safety at work.